First, I would like to thank Chitske and Tanya to invite me here. I'm very happy and that I can talk about our national plan today. I also must say that when we start planning this conference, I think it was 2.5 years ago, my plan was actually to talk about the diagnostic utility about exome and genome sequencing, which we use. But now so many papers are out there already. And in the meantime, I've been very actively involved in various fields of rare diseases. And so I decided maybe it's a good place, even though this is a dedicated seminar, maybe also this, let's say, half political, organizational subjects or areas of rare diseases would be of interest to general public in the field of rare diseases. Because as I heard, you come from different areas, from research, diagnostic clinicians, and so on. So I hope this will be informative, and we believe that it is really a good plan. And before I start, I would like to say that, of course, this is not my work. It's a work of a big group, including Ministry of Health, National Institute of Public Health, health insurance agencies, and various clinicians from University Medical Center. And for myself, I come from the Clinical Institute of Genomic Medicine. I see patients regularly, and I also do some laboratory work. And our clinical institute is a part of the biggest clinical center in Slovenia. And we are also the biggest genetic unit in country with terms of diagnosing rare diseases. Short history. Maybe you already know that, but I think not everything. So I would like to say some words before I present our plan, how it all started at the European level. So already in 2009, the European Council recommended that European action in the field of rare diseases should be adopted but by all European member states, and that all states should adopt their national plans and strategies in the field of rare diseases by the end of 2013. And by the, let's say, by the combination of words, national plan or national strategy, it means, of course, a set of integrated and comprehensive health and social policy actions for rare diseases, with, of course, previous research nationally, what is needed and at which stage each of specific field is in the current development. And this European Council recommendation included various fields or various areas of rare diseases besides plans or strategies. Also, it was adequate definition and codification, because it's very important that we code these diseases equally so we can compare data. Also, of course, research, which is of paramount importance for the development, and centers of expertise and European reference networks, which we all were aware of. ERN Ithaca Cliffstra is under ERN Ithaca. And of course, also gathering expertise at the European level and empowering patient organization, very important. And last but not least, sustainability. Because if we start really actively and it's not sustainable, then at some point it will all just stop. For this reason, European Union financed a project, Europlan, and its main goal was to provide actually, to provide national health authorities some sort of a plan how to start doing and what each national plan should cover. And then in the second phase, it was really, in addition to the first one, it was a second Europlan project, which was built also to provide integrated and comprehensive and long-term strategies. As I said, sustainability is very, very important, because we all know from getting, for example, therapies from research to clinics, it takes years. And so it is with every subject in this rare disease field. And this first round of establishing national plan, it was really European-driven. It was, let's say, organized and harmonized within European Union and all member states. And a nice paper was published already in 2012. And among the first 9 countries, it was also the Netherlands, but also Slovenia, with having national plans and some other areas we are not Not all countries cover everything, but here it was the first result of this, let's say, European-wide initiative. And now I come to our plan, which is already a second in a row, because the first plan was from 2011 to 2020. And when it finished, we were lucky enough that, let's say, appropriate people at appropriate positions that are very active and individually driven to create such things. Because this second, let's say, second part was not European-widely driven as the first one. So after the first national plans, it is basically up to members itself to decide how they want to proceed with the field of rare diseases in the country. It is organized into pillars. So I will now shortly present our national plan, which is from 2021 for the period of 10 years. It might seem very overwhelming and ambitious, but if we are not ambitious, then little will be accomplished. So we believe it's better to plan more and accomplish a lot than not plan enough. So the first pillar is around personalized innovative medicine for rare diseases, and it has two main objectives. And the second pillar is about integration of rare diseases into society, again with two objectives. Under the first objective, which is diagnostics for prevention and treatment, we also already established Center for Undiagnosed Rare Diseases. We just heard a talk a lot about undiagnosed rare diseases. We are very proud of it. It's at our institute. We believe currently it's enough one for Slovenia. Slovenia is a small country. I'm sure you're well aware of that. It's 2 million people approximately. I must say that despite the fact that we already have introduced advanced genomic technologies for diagnosing patients with rare diseases, even 10 years ago, we are very fortunate that our health insurance company covers exome sequencing and genome sequencing for many, many years. So this center is dedicated for those patients where these results were already negative. And then, of course, we know that these technologies have their limitations and specificities. So even if it's a known syndrome, sometimes the mutation is such that it takes a little bit of research to find it, let alone if it's really an unknown syndrome and an unknown disease. Maybe with all these technologies, it's another mechanism that drives the pathology. So yeah. Whole genome sequencing does not give all the answers. So this is already operational. Then in the second activity of this first objective, we are optimistic to be able to provide and introduce genomic prenatal and neonatal screening. So we all know what screening programs are, and we do have neonatal screening, but we would like to transfer it to the genomic data. So it would be very nice. Of course, the main aim of this, of course, would be to develop modern options for primary and secondary prevention of genetic diseases. And before we can introduce the genomic technology into prenatal and neonatal screening, we plan to have a pilot project that would assess, let's say, various fields that needs to be assessed, like possibility of using genomic screening on the nationally wide, also from a professional, but as well as from, let's say, social and ethical perspectives of doing such a thing in the neonatal period. In addition, activity 3 would be also a genomic screening for adult onset rare diseases at the primary healthcare level. The aim would be to enable early detection of patients or people at a high risk for development of rare disease in adulthood. And the secondary aim would also be, of course, to empower the healthy population and primary healthcare physicians to know how to identify genetic risk. Partially, this is already ongoing, as we are just finishing a project on the family history tool. This is a tool that was, we all know what family history is, of course, but this is designed in such a way that specific questions are asked in order to be more oriented towards genetic diseases. Based on these results, we have already created a group of high risk, medium and low risk individuals that are potential of having a genetic disease in their family. And this would be a good candidate, so those with a high risk, to get, let's say, to be referred to clinical geneticists or genetic counselors to let's say make a further insight into their family history to see if they really should be evaluated as a regular and diagnostic genetics or not. And the second objective under this first pillar of personalized innovative medicine is the superb healthcare. And within this objective, we have many activities. First are multidisciplinary teams for rare disease patient management. We didn't have this before in Slovenia. We are all aware that rare disease patients are mostly evaluated and treated within the specialty clinics. Of course, according to the main symptoms and signs that they have. But at the same time, many rare diseases affect various organ systems. So sometimes specialists that are treating the patient for specific symptoms or sign are not aware of other problems that the patients are facing. So multidisciplinary teams should be organized in such a way that patient would have one team visit or one date and time. And then at that place, he would take more hours, and all specialties, so all clinical or physicians and other medical staff would visit him or her at that point. So currently, we have 4 such teams in Slovenia, which is quite enough for a start. Team is consisting, besides the team coordinator, it includes also 2 medical doctors, which are specialized for rare diseases, also 2 registered nurses, a clinical psychologist, social worker, and nutritionist. We are currently evaluating, we have just started it 6 months ago, so we will of course evaluate its efficiency and also patient needs and then develop this further. Another activity within the superb healthcare are also national networks in European reference networks. Slovenia is part of all the European reference networks. For approximately half of them, we are full members, and for additional 5, we are associated members. And then for the rest, we organized a really interesting organizational structure, I think. It's a so-called ERN hub. The same is true for Luxembourg and I think Malta. So these small countries, such as ours, the European Commission were already aware when European reference networks started to form that such small countries wouldn't be able to have really high-level expertise for all rare diseases, or at least all 24 fields in which currently European reference networks are organized into. So it was already planned that maybe some countries would like to have ERN hubs. And we have such a structure at our institute as well. And we cover a few ERNs there. So we are the contact between the patients and clinicians to those ERNs. And we will see how it goes in the future. Maybe we will become associated or full membership partners to those ERNs as well. But currently, we also see it as an option to harmonize these European reference networks in Slovenia, as again, a lot of things are done at one spot in such small countries. Another thing which is planned after 2025 is a national coordination center for rare diseases. Again, we believe this would be very beneficial for Slovenia. Such a center would enable this field to be coordinated and to at the national level, and also that the implementation of the things that I'm really talking about right now would be really, let's say, monitored and taken care of. And also such a coordination center could, let's say, research the field and identify the needs that should be, introduced or addressed later in the process. And also, of course, such a center would be then a direct link to the Ministry of Health and insurance agencies, and also Orphanet and international databases. Two additional activities in the superb healthcare is, of course, access to orphan drugs, which is the same here as it is in Europe, so I won't talk about it at all. And also new treatments for rare diseases and advanced gene therapy for rare diseases. This is also part of the national plan in this 10-year period. We heard about the center that's being established with the European money and probably some Slovenian money as well. Currently, it was before the coffee break, so we would be happy to collaborate. Before that, as this is, let's say, a national plan, we believe that also a small pilot project should be done, where all stakeholders should be involved, to see what aspects should be covered before we start such an initiative. Again, from ELSI perspective to organizational, managerial, financial, and also, of course, professional. And then the second pillar of this national plan is related to rare patients as a focus. And the first objective is sharing information for common progress. And within this, the activity is planned to have an integrated national database for rare diseases. So in this integrated database, data would be structured and organized, various data. The plan is, of course, ambitious, but nevertheless. So the data should be interoperable, to be used in different data sources, to connect to the hospital information systems and also other international databases, because we know, hearing about rare diseases and patients, we are aware that patients from all over Europe and world should be joined in small groups in order to develop new therapies. So we need to have data in an interoperable data format to be able to share them. So this is one of the reasons or a logic behind such an integrated database. But also, of course, beside that, to as I said, to be within Slovenia, to link all information systems, but also to make some financial indicators and monitoring, and then suggest new ways in which this field should be developed. And of course, one small part of this is National Registry for Non-Malignant Rare Diseases, which is already in place, and we will just start to, let's say, registering patients in there, and it will be, as I said, so nationwide. And the second activity within this objective is encouraging the association of all rare disease patients. Once again, some rare diseases are rare, and some are really rare. And for some, there's only single patient in Slovenia, or maybe even not a single patient in Slovenia. So in such a small countries, this associating and matchmaking and cross-referencing is even more important. So we put it in the national plan that some, let's say, mechanisms will be done to even encourage the more associations within different rare disease patient organizations. We do have dedicated organizations, but we also have a national alliance. And some funds are planned for this at the national alliance level to have more interaction with all rare disease patients. And then last objective is objective of integrated social care and education. It has also two activities. One is patient voice for policy making. And with this would be in collaboration with the between the National Patient Alliance and that coordination center, which I mentioned as activity number 6, which is planned after 2025. So within this, we would really love to actively involve patients, to provide inclusive environment for the development of social policies, social services, and also to give patient more voice, more decision-making possibilities, and also to increase their autonomy. And the last activity within this is also education for cooperation. We believe, and talking from experience, even medical doctors are not aware of European reference networks, of course, and even medical doctors that do see patients with rare diseases are not aware of such networks. And we are not aware of many things as well in general in the field of rare diseases. So we believe that, of course, this needs to be promoted in many different ways to the, let's say, general society as well as to the professionals. And this would be also to provide some innovative education approaches for healthcare professionals, patients, and also for the general public. And this is also planned in the second half of our national plan, but also to be continuous after that. And as I mentioned, this is the leaders of group and some clinicians that participated in this national plan. So it's a big thing for our country. And with this, I would like to thank you all for your attention and stop. Thank you.
Thank you so much for this wonderful initiative. I do have several questions, but maybe we can talk later. The one question relates to this registry of all individuals. So what data you exactly register in the centralized registry?
The national registry?
Yeah, national registry.
It was just official. I don't know the correct word, but it's now in our law from the past year. So we will need to input all the patients. We used the European recommendations, which data to include. So it's basically general patient data, and then ORFA codes and type of mutations and such a let's say, and drugs that they used, dedicated orphan drugs or other drugs. So it's a list of data that is predefined, and we are now starting to educate the coders so that they will be able, to help. Not that medical doctors will need to do all the work, but to have like a support administrative officers or so that will be able to enter the patients with, of course, predefined who can do it, who can enter, and who can see the data.
But the data will also encompass the sex, the age,
Yeah, it will basically the date of birth and then when the diagnosis was established. And at the second point, at some point we would like also to input the data about clinical visits. But this is later on. For now, it's basically the data that we can share within the ERNs, European Reference Networks, with other centers as well.
Very ambitious. And about the undiagnosed category, what exactly can you offer for them? What is the idea behind?
Well, we do have we have the newest technologies like optical genome mapping, genome sequencing. We do functional assays for specific variants. So what we think when we organized it was that usually patient is seen by one clinical geneticist, and sometimes we see VUSs, sometimes we do see nothing. And then this would be like a group of several geneticists and other specialists that would then talk about specific patient case by case and decide, whether or not some specific diagnosis is already, there, or we just should try to do methylation studies or, this is the idea behind it.
I understand,
Thank you very much. My name is Gregor Cuzak. I come from the Slovenian Umbrella Patient Association that was newly formed almost a year ago. It just happened so that yesterday I was at the think tank of the European Hemophilia Consortium dealing with registry or registries. So it's a work that I've been involved in on a voluntary basis for the last 2 years. And it's very interesting also that just now in May, an overview article came out analyzing about 800 registries across various diseases. And of course, registries in the rare diseases are super important, especially because of the fact that they're rare. So I'd just like to commend what you're doing. I think it's great. What I would be interested as a representative of patient organizations is that you look into ways of how to connect your registry into the other registries. So the new law on digitalization has a section on that, how to connect things among each other, so that we get the aspect of reusability, interoperability, and stuff like that. But other than that, I'm really happy to be here. There are a few of our members, so we just our members are always associations, so it's just for legal entities. We do have a few of those rare diseases, and I'm sure there will be a lot of interest, either directly in the area of associating among the rare diseases or all the diseases where we actually are covering this. So it's just a comment. Thank you.
Thank you. I just want to address something. it's a national registry, so it was basically, so it's not like a local registry. We have a lot local registries for neuromuscular disorders, for hemophilia, now there is also. So this will at some point need to be joined within this national registry, because we believe, and I mean the society, not I, at some point this will be related to, you know, which patient will get which drug and so on. So this is why it's important to have it in an interoperable way of data collecting. Thank you.
Thank you.